Morning, everyone. I would like to call the Subcommittee on Employer Relations to order. Today is October 5th. I'd like to do a little framework before we begin of how we're going to be moving forward. We have a very tight time that we need to end. We absolutely have to leave at noon. So we have a hard stop at noon. And I know Representative Hillstrom has things today she absolutely has to get to. Her daughter's getting married, and I appreciate you taking the time to come and spend with us. I'm so sorry you had to miss your daughter's bridal gown fitting today. I feel terrible that that happened. And we had other conditions on the committee. We had folks that had pretty bad health issues and just got the okay from their doctor to be able to travel. So we had other considerations. So we do have to have a hard stop. Other folks need to go to a wake. So we will be doing about an hour worth of testimony from MMB and presentations from them. And each of the union representatives will have 10 minutes each to do whatever you would like to do if you want to have public testimony, but we do have to limit it to 10 minutes. After that, we will have discussion here, and then we will vote. So that is the layout. So now I'd like to approve the minutes from May 8th. Can I have a motion?
I'll move the minutes from May 8th, Madam Chair.
Thank you. Motion has been made. All in favor of approving the minutes, say aye.
Aye.
Opposed, same sign. Okay, minutes have been approved. And at this time, I'd invite MMB to come up to start their presentation. Good morning. Welcome to the committee. Please state your name for the record and continue with your testimony.
Sure. Good morning, Chair O'Neill and members of the subcommittee. I'm Edwin Hudson. I'm the Deputy Commissioner of Minnesota Management and Budget. I report to Myron Franz, who's the Commissioner, and I've held this position since February 2016. My responsibilities include the oversight of statewide enterprise human capital, enterprise talent development, labor relations, CGIP, our state's employee insurance programs. My background includes senior leadership positions in human resources and in operations for 2 Fortune 100 companies. As a 16-year veteran, I'd like to pause and just say to you, thank you for supporting our veterans. Thank you. We appreciate in all that you do. We know that you keep us in the forefront of your mind, and we really appreciate that. Thank you. This morning, our agenda indicates that we should review the changes of the state employees group first. I'd like to do that. But before doing that, it might be appropriate for me to just give you kind of a high-level overview of the bargaining process, since it's that process that we've arrived to the proposals that we present to you this morning. MMB negotiates 9 labor contracts. American Federation State, County, Municipal Employees, ASME Master, Minnesota Association of Professional Employees, MAPE, Middle Management Association, MMA, Minnesota Nurses Association, Minnesota Government Engineers Council, MGEC, ASME Unit 8, which is our correction officers, ASME Unit 25, which is our radio communication operators, State Residential School Education Association, SRSEA, and Minnesota Law Enforcement Association, MLEA. I would describe the bargaining process as traditional bargaining. It's led by chief spokespersons. It's a respectful, arm's length process to achieve best outcomes for the negotiations. During the even number years, MMB and state agency labor representatives began to prepare for negotiations by holding joint labor management, JLM, meetings with union representation regarding preliminary trends and data relative to insurance, employee insurance benefits. During the odd number years, MMB formed management bargaining teams, usually composed of human resources and labor relations professionals from our agencies, who then represent management throughout bargaining. In a moment, you will hear how our team, during this particular round of bargaining, negotiated tools. But specifically, we will talk about a few tools as it relates to our employees' insurance. Some of the tools we related, and I'll mention two now. One, strategies to drive down the escalating healthcare cost and programs aimed to improve the health of CGIP members. Two, initiatives to make our state of Minnesota more competitive and an employer of choice. Before noting the specifics of our health and dental insurance negotiations, please be mindful that CGIP provides dental, basic life, and other insurance products for all branches of state government, including the judicial branch, the executive branch, and you, the legislative branch, and your staffers, and Minnesota state colleges and universities. Health and dental insurance provisions were a crucial part of the bargaining process this round, just as it has been for decades. The coupling of the bargaining insurance provisions with wages is necessary so that parties have a clear understanding of the cost associated with the total compensation of wages and benefits. Our employees have clearly communicated that they are not just concerned about what's coming into their pocket with regards to wages, but they're also concerned about what's coming into their pockets with regards to their spend on healthcare benefits. Wages and benefits are considered total compensation. Both are terms and conditions of employment. We're pleased to inform you that the actual medical premium increase, for 2018 is less than our early projections, which was developed using forecasts in claims cost developed by our actuaries at our health plans and our actuaries and actuary consultants that we consult with routinely. The average annual increase in CGIP health insurance claims can vary significantly from year to year. In 2015, for instance, CGIP experienced a 7.4% increase. The volume of expensive, high-cost cases drove that number. These cases are difficult to predict, but can have a total cost easily. A single case could easily top out at $500,000, easily. As a result of the updated data, for 2018, the projected premium increase of more than 8.5% is now 2.85%. Over the 2018-2019 plan years, going from 8.5% premium increase down to a 2.85 actual premium increase means that agencies will be able to spend an estimated $123 million less than previous projection for employees on state payroll. This represents a significant reduction in premiums, lower than expected health care spending. That is the reason for that. In addition to a new pharmacist benefit manager, we have a contract now with CVS Caremark. Now let's talk about some of the provisions included in our negotiations. I'll talk about 4 of them. We have a plan design that will allow our members not to pay co-pays in the event that they use in-network convenience clinics. We're talking about well doctors and doctors on demand. This incentivizes employees to engage in a less expensive healthcare option to drive down cost. These resources are often a fraction of the cost of the primary care office visit. 2, we have value-based insurance design pilot program for those members with diabetes in order to help them manage their care and achieve greater value in the overall plan spending. We currently offer a diabetes program called Amada, which has proven to be highly popular among our membership. As a next step in the diabetes management continuum, This new benefit, called Advantage Value for Disabilities, will reduce cost sharing for high-volume medical services that are primarily for diabetes care, as well as certain testing supplies and prescription drugs. We believe this new pilot program will help improve the members' health as a result of greater value for the plan's healthcare spending. 3, enhance dental insurances include adding orthodontical for any member, increasing the annual maximum, and other benefits enhancements. Dental is a voluntary benefit. The employee shares of the cost, the employee share of the single premium, which is bargained, was increased in order to cover the full cost of all of these enhancements. Evidence show that there is a connection between oral and physical health, and thus we believe these dental improvements have the potential to improve members' health on the medical side as well. Finally, short-term and long-term disability open enrollment opportunity cases where temporary employees become full-time employees. They can go out and get the insurance that they deserve. So I've kind of gone over some of the strategies that was negotiated during this particular round of bargaining. And we talked about the savings in that we have a premium that's less than what was forecast. So I'll pause now to see if you have any questions with regards to our benefits.
Thank you, Mr. Hudson. Representative Hillstrom.
Thank you, Madam Chair. Can you tell me who was in the room when you negotiated these contracts?
Mr. Hudson.
Madam Chair and members of the committee, we had representatives from ASME, and then we also had 2 bargaining cycles going on at the same time, one with ASME and one with MAPE. And then we had management represented on opposite sides of each of them, our team.
Representative Hillstrom.
Thank you, Madam Chair. So, for example, would someone have been there representing institutions of higher education?
Mr. Hudson.
Madam Chair and members of the committee, for the coalition bargaining on the insurance piece of it, we had representation from every group in the JLM. And we meet ongoing, and this, we met earlier as a part during, if you recall, I said on the even number years, there's some work that we do that's preliminary to the bargaining process, and we began our JLM conversations early on, and they carry into the second year, and we have these conversations throughout. And so membership was represented on our JLM teams.
Final question, Madam
Representative Hillstrom.
Thank you, Madam Chair. So in the event one of the entities had concern about their budget numbers versus the contract negotiations, there would have been an opportunity for them to raise those during the negotiation process?
Mr. Hudson.
Madam Chair and members of the committee, in fact, we had those conversations, and we believe we negotiated a rate that fits within their appropriation. They had that opportunity to express that. We also reviewed operating budgets, and we reviewed the financial constraints, and we made our decisions based on the appropriations that was afforded each agency.
Thank you.
Senator Benson.
Thank you, Madam Chair. And I just wanted clarification on the health savings. Do those savings accrue regardless of the status of the contract? Because if we have lower medical trend and utilization, what happens to the excess money?
Mr. Hudson.
Madam Chair and Senator Benson, I'm not sure that I understand your question. The health care savings that we will realize because of a lower premium, we're going to realize that this year in the first year of the plan. And in the second year of the plan, we're going to monitor our experience. That may inform us to do something differently based on our experience.
Senator Benson.
But, Madam Chair, if our medical trend is projected to decline for the year, that happens regardless of what the premiums are. We're a self-insured entity, so does that money just accrue to the reserves then?
Mr. Hudson.
Madam Chair and Senator Benson, I'm not sure I can get an answer to your question, but we won't know what our experience is until well after the year. So the numbers came in around June, And we knew then that our premiums would be what they are, thereabout. So those expenses, those costs are paid for up front. So I'm not sure, perhaps I can maybe meet with you offline to better understand your question.
Senator Benson.
Unfortunately, Madam Chair, we have to make a decision today. So if premiums are paid and claims are below anticipated premiums and the reserves build up in a self-insured plan, those reserves remain in place and they can be used for premium reductions going forward. Is that a correct understanding of a self-insured model?
Mr. Hudson.
Madam Chair and Senator Benson, if you don't mind, I'd like to call up my Assistant Director of CGIP to answer your question directly, if that's okay.
Absolutely. Welcome to the committee. Please state your name for the record.
Good morning. My name is Galen Benshoof, and I am the Acting Director of the State Employee Group Insurance Program. And Senator Benson, your understanding of the way you articulated the question is correct, that if there is lower expenditures on claims than anticipated, that money does accrue to the reserve. But as Deputy Commissioner Hudson explained, we won't actually know the actual amount less than projected until well after the year in question.
So, Madam Chair,
Senator Benson.
and this is just a clarifying, from previous experience, we had collected premiums based on a projection, and we were below a projected claims level. So is our self-insured fund balance above projections right now? Is that why we're able to give this reduction in premiums?
To the testifier.
Senator Benson, we are still analyzing our claims experience from 2016.
Okay.
And part of the reason why we are coming in lower than projected in terms of premiums for 2018 is partially a 2016 story. It's partially also a first quarter 2017 story. We take the best projections from our health plans and our actuarial consultant to develop those future forecasts. But obviously, as you articulated, what our past experience and our reserve level also affects where we set premiums. And we are actually below our target reserve level right now due to a worse than expected experience in 2015. And so over 2016, I think we are building back up that reserve and into 2017 as well. But we are still below that target, which necessitates us to raise premiums just at a level that is lower than we expected to.
Thank you. Nothing.
Senator Benson. Oh, excuse me, Senator Newman. Sorry.
Thank you, Madam Chair. Mr. McCutcheon, I'm going to ask you to try and keep your answers really short because we're so crunched for time. But can you tell us what is the total amount of the increase in dollars from the previous contract to the contracts that we are now considering today?
Mr. Hudson.
This is solely on insurance, I'm sorry.
No, Madam Chair.
Senator
I'm talking
Newman.
the total contracts that we are dealing with today, the MAPE and the AFSCME contract. What's the total amount of the increase in dollars between the contracts that are expiring and the contracts that we are now considering?
Madam
Mr.
Chair and
Mr.
members
Hudson.
of the committee, if we're looking at salaries and the roll-up associated with the salaries, we're looking at $120 million.
Madam Chair.
Senator Newman.
Thank you, Mr. Hudson. And can you tell us what is the total amount the legislature appropriated for MMB to negotiate these contracts? How much money did you have to deal with?
Mr. Hudson.
Madam Chair and members of the committee, I'm not sure that there was a specific dollar amount that was appropriated, we know that we had set aside different agencies about a 1%. And then we realized that we had also appropriated based our insurance premiums based on a higher amount. So there was some money left over from just under 8.5% to where we are today that gave us some room for negotiation as well. So during bargaining, we were mindful of that amount and we stayed within those amounts.
Madam Chair.
Senator Newman.
Mr. Hudson, if you can't tell us the amount of money that the legislature had appropriated for you to deal with, how can you tell us that you negotiated contracts within your budget?
Mr. Hudson.
Madam Chair.
Mr. Hudson, before you continue, I thought I heard you say it was 120 million, but our documents in front of us actually, the total of the two contracts is actually $165,913,713. So I'm not sure what the 120 million is that you had referenced. Maybe you could clarify that and then answer the senator's question.
Madam Chair and members of the committee, the difference between the two numbers is the insurance amount. The 25 million, we're going to have to pay that irregardless of, that's the insurance is going up. I mean, that's what we're going to have to pay for our insurance premiums. So that's the difference between the two amounts. It's my understanding, Madam Chair and members of the committee, that what was set aside in the appropriation, that number included other expenses, not just the expense for wages and salaries. So what we tried to do was to stay within the 1%, then plus the savings that we realized from the reduction in the insurance premiums. That's what we tried to do, and we believe we did that.
Madam Chair, one final question.
Senator Newman.
I appreciate your patience, and Mr. Hudson, can you assure the committee that the contracts that MMB negotiated are within the budget appropriated by the legislature? Can you assure us of that?
Mr. Hudson.
Madam Chair and members of the committee, we believe that we negotiated contracts with the understanding that agencies can manage their contract costs within their existing appropriation absent any unexpected events. So the answer to the question is yes.
Mr. Hudson, when you were in my office with the commissioner, I asked you this question in regards to Minnesota State College University System. And the answer that you gave me in that office was different than what you're saying right now. And I'm wondering if you can reconcile those two, because what you had told me with the commissioner and Mr. Pollock that was there, that in fact, Chancellor Rosenstone raised grave concern that the across-the-board increases were 2 and 2 1/4, when in fact they can only handle about a 1% increase. So has something changed since the last time you were in my office? Because a 1% increase across the board versus a 2 and a 2 1/4% increase across the board are vastly different. And these two contracts actually represent quite a few of the Minnesota State employees. So the last thing I want to see is if we pass these contracts, then the Minnesota State system has to now lay off people. They have to close programs. They have to shut down courses, which is what they've had to do in the past when they've had budget shortfalls. Or they have to come back to us, the legislature, to ask for tuition increases. And so we're passing along tuition increases to the students of Minnesota. So can you please reconcile those two statements, the one that you offered me in my office, that 1% was the most that they could handle, and then what you're saying today about the state agencies saying that they didn't have issue with the increases, which again, we would really like to see that substantiated by numbers, not just a blanket statement across vast numbers of agencies. You know, you had provided to myself and Senator Benson quite a bit of detail across all of the different state agencies. And there were approximate impact on each of them, and they are vastly different. And when we compare those numbers to what was offered in the operating adjustments, they are also vastly different. So I wonder if you could address my question about Minnesota State.
Madam Chair and members of the committee, the reports that was requested of your office and others' office asked for information differently. One may have asked for biennium information. One may have asked for information as it relates to the increased cost for negotiation as it relates to salary. And I think the differences in the report would be the insurance. With regards to Minnesota State colleges and universities, I can't speak to, I don't believe they have finalized their bargaining process, so we don't know what the outcome will be for that. So that's my uncertainty there, and that's what I was referring to in your office. With regards to the 5,000 ASME and MAPE employees that they have, we did work with Minnesota State colleges and universities, and the reduction in the insurance premiums made this contract more affordable as it relates to those 5,000 employees.
Thank you, Mr. Hudson. More affordable, but still there is a vast difference between a 1% across the board increase, which is what the commissioner told me in my office just a few weeks ago, versus a 2 and a 2 1/4. I believe we had some other questions on the committee. On
Representative
this side.
Hillstrom's
Yes,
been-
Representative Hillstrom.
Thank you. I want to go back to healthcare for a minute. So I understand that we would recognize some of the savings just based on lower usage. But can you tell me, if we don't implement the contract language, will you be able to do the incentivizing to use the cheaper programs, which then would also bring down the cost? Or does that require ratification or implementation of the contract in order to recognize those future savings?
Mr. Hudson.
Madam Chair and members of the committee, you're absolutely correct. With regards to, well, let me just back up, if I may, and say that we were very intentional in our bargaining with the JLM group in that we went after strategies that's going to help us reduce this cost, because healthcare inflation is certainly an unknown for us. So those strategies that we implemented, we will get those with the approval of the contract, those strategies, which will help us in the long run.
Madam Chair, actually,
I'm going to go to Representative Drazkowski, and then I'll go to you.
thank you.
Thank you, Madam Chair. Thank you, Commissioner. Commissioner, paid family leave is included in the contract proposal. I understand that the agency is currently implementing paid family leave. Is that correct?
Mr. Hudson.
Madam Chair and members of the committee, pursuant to Minnesota Statute Section 3855, state labor contracts, compensation plans, and arbitration awards, given permanent effect once they were ratified by the full legislature. During the special session on May 24, 2017, the Minnesota Senate voted to ratify the MOUs and compensation plans amendments. On May 25th, the House ratified the same. So PPL is in effect. What we did with regards to the language, or what we did with regards to the contract, was to move the MOU language into the contracts. But the PPL is already in effect and has been in effect upon your ratification.
Representative Drazkowski.
Thank you, Madam Chair, and thank you, Commissioner. And Commissioner, you were, I think, were in the meeting about a year ago when paid parental leave was brought forward by the administration in a way in which I and others characterized as illegal, and it appears that might be continuing. That trend might be continuing. Commissioner, I don't know if you've read actually the language of the conference committee report that was part of the bill, in which the discussion about paid parental leave was placed into. But line 222.15 says that these are conditional on this bill being enacted into law. The bill, Commissioner, did not get enacted into law, and it was the intent of the legislature at that point not to have any approval of paid parental leave unless this bill was approved. And if you read further in that bill, the conference committee report on line 222.17, it says that and amendments to the compensation plans in section 4 subdivisions 1 to 7 are neither approved nor ratified. So, Commissioner, it appears once again that your agency is operating in conflict or in a different direction than the law allows you to. So can you give a direct statement about where the agency and the administration find the authority to move forward as they are now and have been for several months with paid parental leave?
Mr. Hudson?
Madam Chair and members of the committee, while the legislature attempted to make ratification contingent upon the enactment of the SF3 Section 3855 does not provide any contingent approval. Ratification of PPL and MGEC provisions just required the vote of the House and the Senate. Ratification did not require enactment. Again, pursuant to Minnesota Statute Section 3.855, state labor contracts, compensation plans, and arbitration awards are given permanent effect once they are ratified by the full legislature.
Madam Chair?
Representative Drazkowski?
Thank you, Madam Chair. And so, Commissioner, this is a song and dance by the administration to try to illegally put forward paid parental leave, a benefit that carries with it a lot of benefit and a lot of expenses also to the taxpayers of the state of Minnesota. As you know, and as practice is around here, something is not approved by the legislature unless there is identical language in a conference committee report with an identical bill number agreed to by both bodies. That's what a conference committee report is. And I read the language of the conference committee report to you, and the conference committee report explicitly said it is not ratified unless it is enacted into law. That means the governor signs the bill. That did not happen. That exact language with the exact bill number did not get passed by the legislature, by both houses, and the governor did not sign the bill. That would have been required, but again, I'm sorry to see that the administration is once again afoul of the law, and we're hearing more song and dance in order to legitimize that action. Thank you, Madam Chair.
Thank you, Representative Drazkowski. Are there any other questions? And let's keep it the rest of the time to the insurance part, and then they'll do the presentation on the specifics of the contract, and then we'll move forward with more questions and comment about that. Senator Benson.
I do have an insurance question. So, Mr. Hudson, you characterized ongoing healthcare costs as your words were certainly unknown. So right now, our medical trend is stable or declining, certainly not increasing at nearly 9%, which was the projection. And yet you have structured contracts that in order to be balanced in the second biennium would require that medical trend to stay where it's at, 2%, less than 3% growth. You're counting on the savings of approximately $123 million in a single year to offset the increase this year. But in the remaining 3 years of the biennium, which is the world we have to live in, you characterize it as certainly unknown. And so how can you both say we are confident that this stays within the confines of the budget and then say we need to continue a medical trend of less than 3%, which is certainly unknown, in order to stay within the confines of the budget? So you're writing checks you don't know that we can pay within the confines of the existing budget. So could you please reconcile how we're going to keep medical trend on track so that we can afford the raises under existing appropriations. Because our biggest concern here is having to come back for more money, and you specifically characterized medical trend as certainly unknown.
Mr. Hudson?
Madam Chair and members of the committee, thank you, Senator Benson, for your question. 2016 was a very good year for us with regards to our medical experience. And we didn't realize as many major medical events. The same thing is said for 2017. So those trends are very positive, and we're encouraged with that. And we will realize the benefits of those trends for the first year of the contract, well into the second year of the contract. Having said that, it's unpredictable going forward after the 17 year, in that we can have a major event at any time. It really depends upon the health of our members and or barring any accidents. So that could, the luck that we're currently experiencing, the positive trends that we've realized and we will benefit from, that could change and could impact us in 18 going forward.
Madam Chair, the problem is these contracts are permanent. If they're affirmed, the raises go into effect, regardless of what happens on medical trend. And we were told that 2015 was a worse than expected year, and in fact, our reserves are below target level. So if our reserves are below target level now, we had a pretty good 2016, pretty good 2017, but we can't be certain, and nobody can. I understand the nature of insurance fund reserves. I know we can't be certain what's going to happen. If we get a massive flu outbreak in the public employees, those reserves drop precipitously. And then in 2018, 2019, we're going to see a big bump in medical trend if we have some catastrophic event. So do you understand the problem of taking one-time savings and building it permanently into raises? You're not using this savings as performance incentives for 1 year or smoothing out over 2 years. You're building these savings into permanent operating growth. And the math doesn't make sense given the uncertainty that you specifically raised about ongoing medical trend and the unusually low increase this year. So the concerns are getting bigger, and the fact that we're actually below our target reserve level makes me question how much pressure there's going to be on premiums in the years going forward.
Thank you, Senator Benson. And to add to that, as you so articulately pointed out, if we are actually taking one-time savings and converting that into long-term obligations, that puts us in a fiscal deficit. I mean, that it just will. You can't take one-time savings and then, which is what you had said when you were talking about negotiating the contracts. You saw savings in the health plans, as Senator Benson just said, but now you're articulating also that you're going to be using that to pay for ongoing increases. So the fiscal, there isn't fiscal responsibility there. Mr. Hudson.
Madam Chair and members of the committee, we work with our actuaries, with our medical providers, and we work with the actuarial consultants. And we made a very informed decision, and we believe that these savings will be there and help us offset some of these expenses for these increases. We believe that the 2.25% increase is good, fair, and affordable. We believe that. Going beyond the contract years, I can just say that we have to be competitive. And right now, we have some challenges. We've provided you a copy of our top 25 list of hard-to-fill employees. That list will grow and grow and grow if our wages remain stagnant and we don't continue to invest in our employees over the years. So I realize that expenses, having managed the P&L, I realize that expenses are subject to be increased year over year. And I would argue also that if we remain or want to remain or be competitive to maintain employees, then likewise, we have to make an investment in our employees over time. But for this contract period, we made a very informed decision, and we believe these are affordable.
Mr. Hudson, I know Senator Benson and I had asked back in July for detailed information, agency by agency, to find out the fiscal impact by agency. Now, we did not receive that report until the end of the business day of Monday of this week, knowing that we were meeting today. And you had told us repeatedly that it was complicated, it was difficult, and yet the information that we received, Mr. Hudson, was an estimate, an approximation, an extrapolation. It was not actual numbers. It wasn't based on real people with their real salaries, with real increases. It didn't have a real number in it. And then, Mr. Hudson, I get a little frustrated because we've been patient. Then, Mr. Hudson, when I looked at the numbers and reconciled them against the full contract amount, you were missing $29 million in the numbers that you gave me, so they're useless. They were not helpful to begin with because they were just an estimation, extrapolation, a calculation. It wasn't based on actual numbers. But then to find out, Mr. Hudson, that your agency provided numbers to us that didn't in fact include the full cost to each agency. It was short by $29 million. Do you know what we could do with $29 million, Mr. Hudson? I mean, we could finish another section of I-94. We could, I mean, I was on the Jobs and Energy Committee. Do you know how many different programs that we could support in the inner city with $29 million? It's real money, and it wasn't articulated in the document that you sent to me. And you have promises that are empty, promises that keep saying the agencies can withstand this increase. And yet I have yet to see actual numbers, not approximations, not estimations, not numbers that were extrapolated, but real numbers, real people, real salaries, real costs. And then including insurance, because you left that off, which was a $29 million error. I have yet to see that you have substantiation for what you're saying. The numbers don't add up. That's my concern. I believe we have Representative Lilly that wants to speak.
Thank you, Madam Chair, and to focus on, like you said, on the insurance part. Mr. Hudson, I want to, if you can just tell us briefly more about some of the concepts you've come up with, doing some more work on dental issues, and then also on helping folks with directing them maybe on different paths to care, so they would call like a nurse line or something instead. You're trying to not have a copay. I didn't fully hear all that, and that. So I'm kind of glad to hear that you're being innovative, and I think that's kind of an advantage to helping the situation with cost, and that I would imagine that brings down some of the cost to the state for insurance as well, but also it's got to be nice for the customers or the employees as well. So,
Madam Chair and members of our
Hudson.
committee, thank you for your questions and your comments. Some of the strategies that we implemented, again, we were very intentional on that because we know this healthcare, the healthcare inflation is something that's out of our control. We know that diabetes is one of the biggest things that drives a lot of our health care costs, and the care associated with diabetes and the complications that come along with diabetes. So we took that one particular ailment and we put some strategies in place to incentivize the employee to be healthier in that regards, which in the end, the data tells us we will have fewer medical events, fewer complications, and we will have better management with regards to cost. Now, we have some programs already in effect, AMATA, which has been very successful, and we want to continue to build on that and realize the savings by trying to normalize some of the care that our members experience. We'll have healthier employees. When we have healthier employees, they don't have to take sick days, they're present, and they're working. So it helps us all the way around. So it's in our vested interest to try to do whatever we can do to make sure that our employees are present and healthy when they are present. There are other strategies we've implemented, such as allowing them to go to virtual doctors or a minute clinic. As you can imagine, sometimes I might get a fever, rather than going to the hospital, the emergency room, or rather than going to my primary care physician, which is pretty expensive, I now can call up a virtual doctor or use one of these minute clinics, and that is going to be a cost that is significantly less than what it would have been had I gone to the emergency room or had I gone to my primary care physician. So again, those are strategies. We understand the fiduciary piece of this, and we have worked with our actuaries and our actuaries with our health providers, and we're trying to be very frugal and trying to avoid costs and mindful of the potential escalation of healthcare costs by implementing these strategies that will curtail that cost. With regards to the reports that we've provided, I think we have given some disclaimers on the report, and I'll call it a disclaimer, but that's not what I really mean. But on the report that was provided we had indicated on the very last bullet that it did not include the health care insurance. So we knew that it didn't include the health care insurance because the health care insurance is a cost that we're going to have to pay anyway. The cost of bargaining would be the 2 and the 2.25%. We're going to have the health care insurance. We're going to have to pay. We provide our employees health care benefits. So that cost is a cost that we already have. The increased cost would be the 2 and 2.25%.
Okay, thank you, Mr.
Madam
Hudson.
Chair?
We have
Just
Representative
really,
Lilly quickly.
thank you, I'm sorry.
No,
And
no,
then could you
I'm just
just
watching.
briefly on the dental stuff, because I thought that's really fascinating, and linking it to the health of a person's health, linking it to the quality of their dental situation.
Mr. Hudson, very quickly, because we do need to have you present the two contracts, even though we began to talk about them, but it'd be important for you to actually have time to present them. And we have about 15 minutes left to do that in.
Thank you, Madam Chair and members of the committee. Thank you for your question. The scientists, the information, which is very evident, has showed us that some of the prevention can be noticed, or it depends on your dental care. So, for example, diabetes. Individuals who have diabetes, that is something that can be detected during a dental examination, as an example. So there's evidence out there that ties our dental care directly to some of these ailments. So we wanted to make it easier, and again, the employee is paying for these enhancements, these dental enhancements. So again, that's a big one for us management, that the employees are doing that. But again, this will also help drive down the cost.
Thank you, Mr. Hudson. Representative Hillstrom.
Thank you, Madam Chair. I'm just going to make a couple statements about the healthcare piece, just because we're going to close up on the healthcare piece. First off, Senator Benson, I understand that you're very concerned about the predictability of healthcare and healthcare costs, but given what's happening in Washington, D.C., it's very difficult every day to predict what is going to happen to healthcare here. And I don't think that our state employees should suffer because what's happening in Washington is so unpredictable.
Chair, I'll need to respond.
Second, Representative O'Neill, I'm very concerned about your statement about spending one-time money on health care when that is exactly what the Republican Party did in their tax bill. They spent one-time money to give tax cuts, and we may very well see deficits in the future based on tax cuts. And so it's a little hypocritical to say that we can't look at the savings in healthcare and actually use them to benefit employees when you did it for the rich. So that's the end of my statement on healthcare, and there will be more, Madam Chair.
Senator,
And since my name was specifically raised, I will point out explicitly that this is a self-insured health plan. It is not subject to any provisions of the Affordable Care Act. There is no change being made to ERISA in Washington. And so the characterization that chaos in Washington is going to affect this plan is a misunderstanding of the fact that none of the ERISA plans were impacted by the ACA, and this legislature, in our ability to impact the ACA, cannot impact ERISA. This is completely bifurcated.
Okay, thank you. Mr. Hudson, let's move on, and what I'd like to do, just in the sense of time, is have you present the two contracts, and then if we could hold our questions until the presentation is done, and then we'll debate the two contracts. Thank you, Mr. Hudson.
Madam Chair and members of the committee, thank you for your questions. Please allow me to shift your attention now to talk about the negotiated contracts. These are good, fair, and affordable contracts. The proposed wage increase of 2% and 2.25% are below county, state, and national market data. It's affordable considering, and I'm going to mention three things. One, the cost of employee turnover is at least 1.5 times the annual salary of the exiting employee. Two, considering all agencies will spend an estimated $123 million less than original projections for increased insurance premiums. Three, knowing that we negotiated contracts within the understanding that agencies can manage their contract costs within the existing appropriation absent any unexpected circumstances. Having competitive wages goes a long way as we strive to make our state, Minnesota, the employer of choice. Agencies are prepared, all of them, including Minnesota State and universities. Agencies are prepared and supportive of the changes agreed to by parties during negotiations. Now, we talked a little bit about the strategies that we implemented during the health and dental piece of this. We were very intentional even on the non-economic and the economic proposals as well, in that we created some strategies, or we bargained some strategies there. And I'm going to mention 4 of those. During the our team negotiated additional tools to assist with administering discipline during performance management. We also negotiated some strategies to help us with our recruiting, retention, and engagement efforts. You'll hear about strategies that will help us with regards to our succession planning tactics so that we can capture the institutional knowledge that's going out of the door every day. We have very antiquated systems. We have people who cannot even speak COBOL programming language, as an example. We're losing that talent every day. And so this plan, this succession planning pilot program, will help us capture that institutional knowledge, and also it will help us in getting our new employees up to speed very quickly. And then, of course, we also implemented a strategy that's going to help our employees update their knowledge, skills, and abilities. Now, some of you have asked about our general bargaining timeline for bargaining wages and insurance benefits. And I'm going to go through that quickly. January through March, there are pre-bargaining activities such as gathering information from other local governments, from private industry, and other employers on general adjustments, also on interest arbitration awards. And then we also went out and we solicited our agencies. We asked them to give us feedback on some of their concerns, and we asked them if they had any suggested proposals. During March through May, bargaining continues, or we begin to bargain at least, with ASME and MAPE. And also we began our coalition insurance bargaining. During April through June, ASME, MAPE, and coalition continues. Bargaining with the remaining units began. Our CGIP team receives updated claim information, and we update our premium projections. We consider the operating budgets from agencies and Minnesota State colleges and universities. Now then, during push week, of course, our goal is to come to a tentative agreement during push week. That's when we discuss our economic proposals and we land, hopefully, again, with a tentative agreement. Now, we do that April through June, and we do that prior to the contracts expiring, which is June 30th. July through October, There's a vote on the ratification by union members for MAPE and ASME, and this can take up to 6 to 8 weeks. We begin bargaining, or we begin bargaining with the other remaining units, and we're hoping at that point we will start concluding some of them, and their votes will then be sent out to be ratified. The ratified MAPE and ASME agreements are submitted to you for your consideration. After that, we hopefully have a tentative agreement on all the others, and we will forward those to you for your consideration as well. And then after this meeting, we will hope that this information will go to the full legislature for their consideration. So that's the timeline of bargaining. But today we present to you for your consideration 2 negotiated, ratified labor contracts from this current round of bargaining. These contracts represent over 74% of our employees. The contract negotiation period is July 1, 2017 through July 30, 2019. They include ASME, Unit 2, 3, 4, 6, and 7, and MAPE. These agreements cover about 29,000 employees. Now, the types of positions within these bargaining units include, and I'll start with MAPE. For MAPE, we have licensed practical nurses. Now, they're a vital part of the presence of the lives of the sick and injured patients at DHS, DLC, and they also serve our servicemen and women in our vets' homes. Also, we'll talk about HST, which is Human Services Technicians. They provided needed support to individuals with intellectual disabilities, mental disabilities, brain injuries, and other emotional, behavioral, and medical complexities. HSTs strive to ensure the people they serve, their patients, achieve the highest quality of life and personal growth. Then we have office support staff. Of course, they help us and try to help us to be efficient, and my staff person tells me what to do. And then we have service and trade members, which consist of our electricians, our plumbers, general maintenance workers, and our snowplow drivers, who ensure a safe and continuous proper use of our public facilities. Without them, our roads, our bridges would be less safe, and our veterans' home would not have the services that they need. And our Capitol building here, this beautiful building in which we meet in across the street, would not have the running water, the power, and the temperature-controlled environment. Let me mention a few of those positions from MAPE. We have information technology security specialists. There are frontline to cybersecurity resources who support very complex databases, such as our healthcare coverage, providing healthcare, databases that provide healthcare coverage, or databases that ensure child protection and welfare services. Then we'll talk about forensic scientists in crime labs. They examine physical evidence collected at the scene of the crime. If there's no known witness to the crime, many times forensic evidence, that's all the prosecutor would have to try to solve the case. We have food inspectors. They ensure the safety of fresh packaged foods. Inspectors determine the minimum standards and practices are being followed. We want to make sure that they're being followed, and they're very important to us as well. Then we have finance and internal control specialists. They evaluate our budgets continuously and systematically to ensure that taxpayer dollars are being purposed towards the best interest and highest use.
Mr. Hudson, we do have a tight timeline, so if you want to get to the absolute highlights of the actual contracts, because you have 2 minutes now to do that in.
Thank you, Madam Chair. During this round of bargaining, parties began in March, and we reached tentative agreement in June, and after negotiating wages and economic proposals during Push Week, which was the last 2 weeks of bargaining, terms were ratified by union membership in late August. Now, these 2 contracts with regards to the economic proposals are the same, and they are progression steps in both years of the contract for those employees who are at the max of their range, which is further contingent upon satisfactory job performance. Now, while the average step increase is about 3%, please know that 48% of all bargained employees are at the max of their range, which means that they will not be receiving step increases. The other condition was a 2 and 2.25% increase, which we've already talked about. We believe that we negotiated these increases. We believe they're modest, and we believe that it's necessary. Our unemployment rate here in the United States is 4.3%. In Minnesota, it is 3.8%. There are some communities where it's higher. There are some communities where it's tougher. Take, for an example, Hastings, where we have a dire need for HST workers, and we are difficult to compete there. Our HST workers in all of our facilities, we can't find them quick enough. They're starting to quit, and they will leave and go work for Target for better working conditions because we're working them. We're requiring them to work overtime, and they get tired, and they want better working conditions. So we have problems with HST. So we know that there are several counties who have unemployment rates that are less than what our state unemployment rate is. Many of your counties, such as Anoka, Goodhue, McLeod, Sibley, Stern, Wabasha, Winona, Wright, just to mention a few counties where the unemployment rate is low. Multiple commercial organizations such as World at Work, the Conference Board, Economic Research Institute, Aon Hewitt, Willis Towers Parents have all projected a private industry increase of 3% or higher for this same 2017 year. The median increase for other Minnesota metro county entities is 2.5% for this same bargaining period. Please don't lose fact that many of the private companies we compete with have other tools that we can't afford or we don't even offer.
Mr. Hudson, you're out of time, and we do have to keep to a time schedule. Did you say the parts about the actual contract that you wanted to? Because you've said a lot of ancillary things, but do you want to talk I'll give you 2 more minutes if you want to focus on just what is in the contract, not other things, but we really have to keep to a tight timeline.
Madam Chair and members of the committee, I can go and I'd like to note specifically what's in the MAPE and ASME contract, if that would be helpful for you.
Mr. Hudson, I believe that's what we asked you here to do. So if you've said a lot of different things that aren't other than the percentage increases. If you could summarize in the next 2 minutes or so the basic changes in the 2 contracts.
For the MAPE contract, as a pilot, the employer can suspend an employee reducing their vacation balance rather than imposing unpaid suspension in cases where the employee's attendance at work assists in correcting the performance issue. We also have phased retirement program, which is discretionary. This pilot program allows employees to reduce their work schedule while maintaining full-time benefits in order to transfer institutional knowledge of legacy system and processes. We have private sector vacation credit. Employees with private sector employment experience can now get credit towards their vacation accrual. This is going to help us significantly with our recruiting and retention efforts in that we can get those mid-career level employees who would not otherwise come to us because we can't match their vacation. We also negotiated contracts to allow 40 hours of release time for our employees to have some training. And then, of course, we increased the deferred compensation match from $1,000 to $200. Those are some MAPE proposals that we negotiated. ASME included, we negotiated some hiring incentives for some of our difficult positions, such as our nurses and HSTs. We have a pilot program allowing discretionary weekend bonuses to improve staffing levels for employees working in the direct healthcare positions. So they're challenged and they don't want to work in the weekends, and we are trying to incentivize them to work weekends. We also inserted a flow chart with regards to the layoff provision. We believe that that's going to help us in the long run, and we hope not to have grievances or arbitrations. They have the ability also to use vacation within the first 6 months of employment. There's an increase in the number of possible hours of injured on-duty pay from 240 hours to 300. ILD pay is limited to those who are injured based on an overt action of a person while attempting to apprehend or restrain such a person in the coordinate. And so if there's a person, for an example, perhaps at St. Peter's, who might be experiencing some psychological disorders, if this person gets hurt, that's when the ILD pay will kick in. Overall, in conclusion, overall, we believe these terms and conditions of employment that we agreed upon are fair and affordable. Madam Chair and members of the committee, I'll just pause for any questions you may have.
Mr. Hudson, I think since we've used up quite a bit of time already, what I'm going to do is allow the two unions to come up to discuss their, say what they want to say for 10 minutes each, and then we'll bring you back and we'll have a debate and more questions. But I really want to make sure the unions have an opportunity to speak. And I'm afraid if I open it up to questions, we won't get there. So we're going to, put you on hold for just a minute and invite, if MAPE wants to come up and do their presentation, and then ask me after that. Thank you. Welcome to the committee. Please state your name for the record.
Madam Chair, my name is Chet Jorgensen. In committee, I'm the statewide president of MAPE. MAPE represents around 14,500 professional employees who work for the state, and I work at the Minnesota Department of Commerce. I know that your time is short, and I don't want to be repetitive of some of the things that have already been said, so I will try and truncate my remarks. Negotiators for MAPE in Minnesota Management and Budget spent 4 months negotiating a fair contract. This contract is affordable. It has been funded by the legislature and agreed by the agencies through their participation in the negotiations process. With agencies required to spend their budget, we believe that this is a good contract resolution for the people of Minnesota. It is responsible to the people of Minnesota and addresses many employment concerns that the agencies have. We believe that we've made some real progress on things like phased retirement and career development so that we can have new people come and work for the state and stay. I think if you asked any of our members, they would be able to articulate that Minnesota is behind on its payment on the salaries that it offers for our members. Between 2000 and 2016, MAPE's compounded salary increases were a little over 37%. At the same time, the Bureau of Labor Statistics said that wage growth for public and private employers with a bachelor's degree was over 49%. Social Security reached 43.35% during the same time. The federal employees received 45%. So I think the statistics point really to the fact that Minnesota is really behind the ball on the salaries that it's paying our members. We were able to negotiate a 2 and a 2.5% across the boards. This pay increase was lower than our current contract, which is 2.5% in both years, but we feel we made significant progress in some other areas. If you look at what's happening in other states, states like Georgia, Indiana, Kansas, Louisiana, Nevada, even Wisconsin, a 2% across the board pay raise has been consistent with what many of those other states have been providing. The average, according to the Society for Human Resources Management, the average wage increase in the private sector for 2017 is 3.1%, and they're projecting 3.2% in 2018. One of the things that we, as MAPE, and I think ASME would also say, is we're proud of the work that we provided on health care. As you heard, the data is showing that the costs of health care are going down or maintaining more level. A lot of that can be attributed to the hard work that MAPE and ASME has done with CGIP to bring those costs under control, with balancing co-pays with out-of-pockets so that people don't go to the doctor unless they really need to. The single pharmacy manager, which is saving tens of millions of dollars for the program, is an issue that was pushed forth initially by MAPE and ASME. The diabetes program that can save the state millions of dollars was also another program that was initiated by the unions. We come to the table as partners because we want our healthcare program to be successful. Anyone who works for the state of Minnesota, and that's including me, we see how difficult it is to fill positions and keep positions. And Mr. Edwin talked about some of the issues that they face in competition, but to just give you a little bit of perspective on that, depending on the agency and the year, Minnesota's turnover rate is between 12 and 15%. MAPE saw its membership change by 13% in the last year. That's turnover. And I think that this is really hard to believe, but 43% of people who were employed in a MAPE position over the last 10 years are no longer in a MAPE position. There's that much turnover that's happening. One of the things that I think that another thing I'm really proud about our union is really looking at what do we have to do for the workforce of the 21st century. Because our contract is about healthcare, our contract is about across the boards, but we also want our agencies to be successful. Nobody wants to come to work and fail. And one of the things that is really preventing us, me as an employee, to be successful is the turnover. And we proposed as part of our contract a phased retirement so that as people are at the end of their career, they can train new employees who are coming in. You would be shocked at the number of new employees who come in and are put in their cube and said, you have to learn your job, because the agency wasn't in a position to have those baby boomers transfer that knowledge. We also looked at a career ladder. The new folks who are coming in to the state workforce, they want to be able to come in and see that they can do something with their career. They're not satisfied to come and stay in the exact same position and do the exact same job for 30 or 40 years. We proposed, and Minnesota Management and Budget accepted a subcommittee, a task force, on looking at how can we have career ladders for our members. With that, I guess I will end my comments since you've already heard most of what I was going to talk about.
Thank you for your testimony. Do you have any public testifiers that will be testifying? You have 5 minutes left if you wanted to use that time.
No.
Okay.
Madam Chair.
Yes.
I've
Representative Hillstrom.
met with 2 MAPE people that if he's not going to take public testimony, Lynn Butcher and a Cindy Arnhart, they are from MAPE, and
Yes.
if they could take that remaining 5 minutes, Madam Chair, that would be helpful.
Thank you, Madam, or excuse me, I'm going to call you Madam Chair.
That's okay.
Representative Hillstrom, yes, and Cindy actually is from my district, and she and I have spent quite a bit of time together. So if they would like to come up, you have 5 minutes more.
Come together.
Cindy, if you want to come to the testifier stand, you certainly can too. Good morning, welcome to the committee. Please state your name for the record and continue with your testimony.
Good morning, Madam Chair and members of the committee. My name is Lynn Butcher. I'm a quality officer at Forensic Services, which is part of Direct Care and Treatment and Department of Human Services. I'm coming today, and I ask that you vote yes on our contract. I'm also a member of the MAPE negotiating committee. So I spent the 4 months with the rest of my committee in negotiating what I think is a fair contract. In approaching this contract, we really looked at how do we make our agencies stronger. In my own agency, in Department of Human Services, we have about a 19% turnover rate. The MAPE staff turnover rate in forensic services, which includes the Minnesota Security Hospital and Competency Restoration Program, dealing with the state's mentally ill and the rest of direct care of treatment, mentally ill, substance abuse issues, and other people who have been committed to the care of the state. We have almost a 16% turnover rate in MAPE staff at Forensic Services. These are psychologists, mental health professionals, licensed alcohol and drug counselors, and it's difficult to recruit those people who are very necessary to the success of our programs. Our wages are not competitive. When we look at our studies, MAPE members are paid about 15% less than the national average because of the amount of education that is required for our positions. Most of our licensed individuals have continuing education requirements in order to provide the best care to Minnesotans possible. And we are very understaffed in forensic services. We are looking at doing recruiting right now, and it's very difficult. Sometimes it takes 6 months to fill a clinical position because people can find better wages, better time off, and they can also have a career path. Oftentimes, there isn't a career path. I just left a position of 10 years. I was a specialist in training and development, providing orientation services to our forensics program for 10 years. And there was no career path for me, and so I ended up taking a different position, thankfully within my own agency, so I can continue to support the great programs. But that was something that we really focused on in negotiating this fair contract, was how do we get people to come, how do we get people to stay, and how do we get the best people? I think that we've put together a good plan, and I ask you to support that.
Thank you for your testimony. Welcome to the committee. Please state your name for the record and continue with your testimony.
Thank you. Good morning, Madam Chair and members of the committee. My name is Cindy Earnhardt. I work for the Department of Corrections out of the Buffalo office. I'm not here as a representative of the Department of Corrections, but rather as a member of MAPE. And I just want to explain what it is that we do, what agents do in my position, which would include, I supervise adult felon offenders, offenders that have been released to the community and placed on probation by the courts, and also supervised releasees that have been released from the prisons and are now in the community. We have a lot of struggles. Out in Madam Chair's district, we lack resources. So we're constantly having to kind of think outside the box, work with the offenders. Our intent is to guide them, to help them through the system, through their struggles. A lot of the people we deal with are chemically dependent. I don't have statistics. I would guesstimate at least 80% chemically dependent, and I would guess almost as high those that are chemically dependent have mental illness issues, mental health issues. Most of those that are chemically dependent with the mental health issues would rather be labeled chemically dependent among their peers versus having a mental illness. So working with them makes our job very difficult. I average 60 to 65 hours a week working as an agent. Because we don't have enough staff and our caseloads are so high, I get paid for 40 hours a week. But my job is important to me, and it's important to the safety of Minnesota. Most of us in this room have offenders living in not just their community, but in their neighborhoods. Most people don't know that and don't realize that. And I would like to believe it's because we do a good job at keeping you safe, keeping our communities safe. That's what we're about. That's the Department of Corrections mission. So, that's kind of it in a nutshell. We work with multiple agencies, chemical dependency programs, most of which we don't have in our community. We've got a couple outpatient programs. We struggle with finding transportation, housing, huge issue. I've got quite a few of my felons are homeless. So we're out running in the community. Those that do have homes, Madam Chair is going to experience tomorrow. She's going to shadow me. At this point, I don't know what we'll be walking into, but some of the homes are awful, awful icky. You'll walk out, you just want to strip down, get into a hot shower, and you're walking out. These homes you walk into also, are there going to be weapons there? We deal with sex offenders, people that have been committed of heinous crimes, serial rapists, murders. Not all of them are that. I would say that's a small percentage, chemically dependent, mentally ill, high percentage. So again, in a nutshell, if anybody has questions or would like more information.
Thank you. Thank you for your testimony, and I look forward to the ride-along tomorrow to see what you do on a daily basis. And I do thank you also for taking the time when I came out to your office to sit down with me and talk about all of these things. So I personally really appreciate it. So thank you for your testimonies today. And is ASME coming to testify today, or are you opting to not? We won't be testifying today. Thank you. Okay.
Madam Chair?
Yes. I'm sorry, Representative Lilly.
Madam Chair, I know the clock is really ticking fast here. I was wondering if I could make a motion to ratify the contracts. Maybe Mr. Hubinger could hand out SER 2, I think it is. And we don't have to vote on this at this point, but just put a motion before us that we ratify the contracts as submitted.
So Representative Lilly, you'd like to make the motion, but table the motion until we finish the discussion?
Not table it, but just continue to have discussion.
Okay, so-
And you can vote, you're the chair, so you can vote when you deem appropriate.
Okay, so we will,
But I don't think members have anything before them. It wasn't in our packet, so I just.
no, because they were, Representative Lilly, I believe they were amending some things, and so I'm not sure
Well-
if they were amending this one, but, so your motion is to have a vote on SCR 2. But you would like to, you'd prefer to wait to vote until we finish the debate?
Yeah, I didn't want to interrupt, but I want to make sure we're less than 20,
Oh,
less than
absolutely.
a half an hour. I
Yes.
didn't want to be to the last second. And
Thank you, Representative Lilly. I
Trying to
will
help.
absolutely do that. We'll enter that into the record, the motion, and we'll wait to actually vote until we finish the debate, but we absolutely will vote on that. I guarantee you we will vote. And I would like to stop it at the very latest at 5 minutes too for motions and votes. All right, so at this time, since we're not having an additional testimony, I will open it up to member questions, concerns, comments. And we do want to have a stop at 5:02 so we can vote. Senator Benson.
And if Mr. Hudson, if you could help me. Mr. Hudson, we have some information in front of us about the Health Department and Human Services Department and the impact of the contracts. It looks like under Human Services, the cost is about 22 million for the biennium, but the total operating adjustment was 31 million, and so that leaves 9 million for all increases in rent, all increases in any materials that need to be provided. DHS has had some problems with fines. So I guess my concern is if the salaries alone are taking 22 million of the operating adjustment, are you going to still contend that all other operating increases within the department can be fit within the $9 million?
Mr. Hudson.
Including
Chair.
healthcare, Madam Chair? Mr. Hudson?
Madam Chair and members of the committee, I cannot speak to the other expenses or the cost pressures that other agencies would have. I can only speak to the cost pressures that we have currently. I will also tell you that DHS is also spending $45 an hour on vendors who they have contracted with to provide services, medical services, for a position that we can pay $12 to $14. So if we were allowed to get these contracts, it will help us in our recruiting efforts, and maybe they would not be required to spend 3 times as much for a vendor for some of the same services that an HST could provide.
Madam Chair?
Senator Benson.
So you're telling me that the Department of Human Services is spending $45 an hour when they already have an open FTE position that your contention is they could spend $12 to $14 an hour on? Did you really just tell me that they're spending $45 an hour when they could be spending 14 on an open FTE position?
Mr. Hudson.
Madam Chair and members of the committee, I'm suggesting to you, or what I'm saying to you, is that it takes 104 days to fill an open position. That particular position, HST, 104 days. And we currently have 41 open positions. That's just the ones that we have posted. There are positions that we've given up because it takes so long to get them posted. So the open positions is really much more greater than 41 days. So we have services that aren't not being provided through these positions that are these vacancies. So the services must be provided, and they have found a way to do that, contracting with some of these nurses vendors, and they charge $45 an hour plus overtime. Sometimes 3 times the cost of what we would pay these employees if we were more competitive.
And Madam Chair,
Senator
I guess
Benson?
my concern is, why isn't the department just paying the employees more? I mean, seriously, if they're already spending $45 an hour, just bump, if they're already spending $45 an hour, why don't they just give the employees a raise?
I want to remind the public that this is a public hearing, and outbursts, I appreciate your support, but your outbursts
The
are not
point-
appropriate.
The point being, Madam Chair, this is the problem. There's a specific, narrowly construed need that you've identified as critical, but we're not focused on critical needs. Okay? We're doing a really broad brush here. Secondly, you have contended several times that the department could absorb these contracts. And the number you gave us was 22 million out of a $31 million operating increase. So that leaves $9 million for all other changes. In the Department of Health, you tell us that just the salaries, 6 million, almost 6.1 million, total operating increase is 6.3 million. So that leaves about $200,000 for rent increases, equipment replacement at the Department of Health. So you're telling me that you negotiated contracts within the confines of the operating budget, but when I present you with numbers that the legislature approved, you can't reconcile your salary numbers to the numbers the legislature had approved. So I don't know how you can assure us that there aren't going to be cuts. Is the Department of Health supposed to not replace equipment that's failing? Or you didn't negotiate within the operating adjustment in a way that allows the department to make decisions. What if they need to change their rent profile? What if they need to move facilities? What if their furniture's all broken? We gave operating increases with the understanding that these would be lived within. Now I feel like you're putting these departments in an untenable position. The Department of Health is going to have $200,000 over biennium for all their operating changes. So I'm not sure how that's going to work. So if you could address how we reconcile those numbers, I'd appreciate it.
Mr. Hudson?
Madam Chair and members of the committee, what I am saying to you this morning, or attempting, perhaps I'm not very good in my articulation, I'm saying that the 2 and 2.25% increase, that money is going to come from the money that we're going to save, not having to pay nearly 9% healthcare premium rates. And it's also going to come from the money that was set aside for salaries and wages. So if you look at those 2 buckets, I cannot speak to all of their other operating pressures, their cost pressures. I'm not their CFO. I'm not sure how they did that. But the numbers that was given us, that was appropriated by the legislature, that's this contract, these 2 contracts, based on those numbers, is affordable. But what I'm also saying is that if we can't get the contracts approved, there's other costs that will continue to rise. And if you feel that we can't afford some things today, we probably will not be able to afford it when 1/3 of our employees who are eligible to retire today can leave today, should they want to. And if it's taken us 104 days to fill that one position, and if you talk about our total time to fill across the state, across all position, is 65 days. So if it takes us as a state, on average, 65 days to fill the position, the work is still there because we're statutorily required to do this work. So agencies have to find ways to make this work happen. And that is more expensive than us being more competitive and able to compete with other people who we compete with.
Representative Drazkowski.
Thank you, Madam Chair. Thank you, Commissioner Hudson. Madam Chair, we're running short on time, so I'm going to abbreviate my comments and then provide what may be a rhetorical question, and that is, Commissioner, I do see here the list of items that the taxpayers have relented to in this discussion and in this negotiation. And we've got very large across-the-board increases and the step increases as well, amounting to, in the next biennium, close to $250 million increase in cost to the taxpayers of Minnesota. So we see that list, and I think you've done a very good job of putting together a sketch of what those items are that the government has given into in that negotiation, but I have not seen the list of items that the bargaining units have relented to in the negotiations and what they have given up. I suspect there isn't one, but maybe there will be one coming forward afterwards, and if so, I'd be interested in seeing that. With that, I've handed out to the members, and I should...
Representative Drazkowski, I don't mean to interrupt, but literally what's under your hand is what the unions, the big, right there, is the list of things that the unions did not get. Just because I thought you might ask that, and so that's been provided in your packet of things that they
No,
didn't.
that's, Madam Chair, that's not what I'm asking. I'm asking what the unions gave up, and I don't see any
Oh, I
in that
understand.
list that the unions gave up. Certainly, the taxpayers of Minnesota gave up a lot in this negotiation. I haven't seen any position that the unions have given up, so I'd be interested in that similar construction as well.
Thank you, Representative Drazkowski. I just point that out because I think he was reaching for the same document, and I thank you for that clarification. Please continue.
Yeah, that's kind of, Madam Chair, it's kind of like bonding, you know, you go around the state and what do you want us to build? And there's all kinds of proposals, and the people in these unions are creative and do good work in developing these proposals. So I see a long list of things that they would like to have, of which the taxpayers in this negotiation have given up numerous items of those. So I'm curious what the unions have given up in that fair and honest and equal negotiation, or however it was characterized earlier. Madam Chair and members, I've handed out a summary comparing not only the increases for both AFSCME and MAPE in these proposals before us, both the COLA increases currently proposed in fiscal 18 and 19, but also going back about 6 years, put together by our House Nonpartisan Research staff, comparing that against the Consumer Price Index in the state of Minnesota. In other words, the best measure of inflation that we have, and also the individual median income changes that we have currently that go up to fiscal year 16. And members, as you look at this, you can see very clearly, even if you just start with the COLAs and compare those, COLAs have been increasing about 2 to 3 times the amount of the Consumer Price Index in each of the last 2, or actually 3 contracts. And certainly, I think when the numbers become available, we'll see that these very generous COLA increases also are increased at a rate significantly faster than the Consumer Price Index, again outpacing inflation dramatically. Also, if you look at the total increases over time to these, you'll see that the increased totals for both MAPE and AFSCME that the taxpayers of Minnesota have provided to our government workers has been as high as 5% of the individual median income in the state of Minnesota in the last 3 contracts, and variations near and down from that in other years. So we're seeing, and I would suspect that these, again, very generous increases when the numbers of the median income earnings and the consumer price index become available will again show out to be above the rate of both the CPI and the median individual earnings. And members, I'm concerned about this trend, and you know, we've heard some song and dance today, and we've heard that each of the last 2 contracts making this look like modest increases. I'm concerned that what we have here is increasing the payrolls of people who happen to work for government at the expense of people who don't work for government. I think of the farmers in Minnesota that are struggling with the price situation that they have right now and the horizon that they have ahead of them. Many of them going to be facing significant losses in the next year, still not taking away from their liability as they go forward to pay for what government charges them in their taxes, whether it be income taxes, property taxes, or sales taxes. I think about the waitresses in Minnesota working to make a living and take home as much of their payroll as they can, and having more of their payroll taken away in order for state government workers to be able to have these very generous increases that we have presented before us today. I think about the hardworking construction workers up pounding nails and working their tails off every day, not getting these types of increases. As we can see, the median individual earnings have significantly trailed what we have generously given of their money to state workers. The beauticians and people who cut hair throughout Minnesota and their ability to continue to pay the bill on their mortgages, to pay for the education of their kids as they go forward, as their payrolls are significantly decreased by more and more government taking, by the generousness of government and this body and the decisions that we make. I think of the truck drivers hauling our commerce around the roads of the state of Minnesota and beyond, sea to shining sea, as they work hours upon end, not seeing their families, and trying to bring home the bacon for their families, and seeing that the pile of bacon at the end of the week is smaller than it would have been otherwise, because we continue to give so over generously to our state workers. The factory workers throughout Minnesota.
I'm sorry, but we have 4 minutes left for a member conversation, and we have several people that still want to speak.
Thank you. I'm almost done, Madam Chair. The factory workers, the care providers of Minnesota, the daycare providers, and the people who work in sales and other places, and their inability to take home as much money that they earn each day because they have to pay for the unrelenting burdens of government. Members, there has to be a point where we start to treat things equally. There has to be a point where fairness becomes part of the discussion. The people in Minnesota paying for the government are not making these types of increases. And we're seeing this over and over again, and we hear from the government the song and dance, but members, the gig is up. This is what we have.
Senator Simonson.
Thank you, Madam Chair, and just try to bring us back to some reality here for a minute. I think, and I'll keep my comments short, I think it's really important that we remember our role is not to micromanage the executive branch. We as legislators have given them the authority to negotiate contracts with all of our state employees, and what's before us here today represents, just short of 29,000 individuals. And we heard that they're LPNs, we heard that they're mental health providers, we heard that they're tradespeople, we heard that there are people, working perhaps for $12 and $14 an hour. These are the people that do the work. These are the people that make the state function. The things that we need to consider as facts. A, these are terms and conditions of employment contained within these agreements. B, they were negotiated in good faith. You see a recommendation here from the administration to support these contracts. You see a recommendation here from MAPE to support these contracts. So what is our role? Our role is simply to determine, is this a reasonable agreement? Should we vote yes or should we vote no? And when we consider whether it's reasonable or not, we simply say, what are the comps? What are the comparisons? And Representative Drazkowski, I'm not quite sure where that data comes from that you just shared with everybody, but we heard here on tape testimony from MMB that comparisons were done with other public employees, with the private sector, and nonprofits. You need to consider the fact that this open position list is very real and that these are hard to fill positions. Why? Because they're low pay. We should just simply give them a raise. Third piece and final piece that we need to consider is, can we afford it? And this is perhaps the most important piece because it gets to many of the points that were made around this table here today. We can afford this. Why? Because MMB has directed the agencies to work within the confines of their budgets. The budgets that the legislature approved, passed, and the governor has signed into law. I heard that very clear a number of times. So I think when we consider, the overall cost of the contracts, balance that with the projected savings in health insurance, this is a very good deal for the state of Minnesota, and we absolutely would be hypocritical if we voted no.
Thank you, Senator. We are at the time that I would like to deal with motions and voting, and I know that there's so much more to say, and every member wants more to say. Just one final thought, literally directed with what you just said, Senator Simonson. I appreciate you saying all that. We do need to be fiscally responsible, and we have repeatedly asked MMB, as I had stated, for the hard numbers of how does this affect each agency? Does it fall within the parameters of the budget? Show me that and document that with actual numbers, with actual salaries, actual people, actually increases, and so on and so on. And I'm not satisfied, and I don't believe Senator Benson, who also received the information and reviewed it, is satisfied that they can show that it actually is fiscally responsible. I have great concerns. And let me just point out one thing before we go to Representative Lilly's motion, because we have a hard stop at noon. I would direct your attention to the packet that it was emailed out to you early on, and it's from Mr. Hubinger right here. And something that's incredibly important to think about as we go to the vote is if you look at the second to the last page, and I don't believe they're numbered, but if you consider in the very last column where it says impact on the next biennium, those are estimates from the last time we did contracts from 16 and 17. And it was estimated under the AFSCME contract that it was going to cost $152 million and some change. And when you look at the previous page, it has the actual cost. It was 158. So it was only $6 million underestimated, which isn't so bad. But the next line, 4 lines down from there is the MAPE. And it was estimated with the last contract that it was going to cost $202.7 million in the biennium. But the actual cost to the state of Minnesota wasn't $202.7 million. It was $338 million, which is a difference of $135 million. So in total, that's over $140 million off from their estimated, after contracts were already finished, to what we actually paid in the biennium. And as you know, we have a revenue shortfall right now of $150 million. So while we have many verbal assurances, I have yet to see concrete numbers other than these numbers that show me that their estimates are vastly different than the actuals. Estimates and actuals are two very different things. I asked for actual numbers and I didn't get them. I got extrapolated, I get incorrect, I got all kinds of things, but I didn't get actual numbers. But their estimated numbers, again, were $140 million off of what we actually paid. So as much as we've had assurances that this was done correctly and within the budget, I have yet to see evidence on paper, in numbers, in actuals of that actually happening. And we have to go to Representative Hellstrom. if we want to get you out of here to get you back to all your wedding things, we have to go to the motion that was brought up earlier.
Madam Chair,
Senator?
I would like to say that I would like to have some of us be able to have a say. I believe that you and Senator Biskowski and Senator Benson have taken up the majority of the time of this committee, and I believe Representative Hillstrom has some valid points to make.
Well, thank you. It would be up to Representative Hillstrom if she wants to spend an extra few minutes before she has to run back to what she has to do with her daughter and the wedding, so.
Well, Madam Chair, maybe we could vote on Representative Lilly's motion, and if that goes down, maybe then I can have the opportunity to speak before you vote on the next motion.
Representative Hillstrom, it is up to you. If you have a few extra minutes with us, I would entertain that.
I will spend all the time it takes, Madam Chair.
Thank you, Representative Hillstrom. Okay, on the table, we have Representative Lilly's motion. Would you like to renew your motion?
Thank you, Madam Chair, and I believe all the members have, and before them now is the SER2.
Yeah, on the blue paper.
And hopefully you see it, and it's to ratify the contracts that are before us today that have been negotiated between the governor and his team and the workers of Minnesota. And Madam Chair, I'd like a roll call, please.
Roll call being requested. A roll call will be granted.
Thank you.
Okay, Representative Lilly moves the SER number 2. All those in favor of the SER 2? Oh, roll call. Yes, I'm sorry. And Sally, you'll be taking roll call.
Chair O'Neill.
No.
Representative Drazkowski.
No.
Representative Hillstrom.
Aye.
Representative Howe.
No.
Representative Lilly.
Aye.
Senator Benson.
No.
Senator Eaton.
Aye.
Senator Karan.
No.
Senator Newman.
No.
Senator Simonson.
Aye.
4 aye and 6 no.
Okay. Thank you. The motion does not prevail. I would entertain another motion.
I'll move SCR1, Madam Chair.
Okay. Senator Benson moves the SER.
Madam Chair, we
We need it again.
don't
Oh.
have anything.
Okay, that will be passed out. I will wait until we have this passed out and you have a moment to review.
And
And-
Madam Chair, while
yes,
this is
Senator
being
Benson.
passed out, perhaps if Representative Hillstrom would like to
Yep.
read the motion, otherwise I'll walk through it, but I would defer to Representative Hillstrom if she wants to make comments.
Madam Chair, I'd like to hear what she wants to say about it, and then maybe I can respond.
It-
That'll-
Fair enough,
I was
Representative Hillstrom.
literally just going to go through the bullet points. Paragraph 1 disapproves. Paragraph 2 puts some conditions that we would like to see into place. State agencies being able to live within these means, better documentation, step increases based on merit, negotiated agreements should include limitations on memorandums of understanding. Management and budget has not effectively demonstrated that salary increases that budget increases are sufficient to pay the contracts, that the parties can return to the bargaining table, and we would like to see a second shot at this, including some of the concerns we've raised here.
Thank you, Senator Benson and Representative Hillstrom.
Thank you, Madam Chair, and I'll just make my final comments now. On July 20th of 2017 at 10:30 a.m., Madam Chair, you tweeted out about how you filed suit to get your raise, which was a 45% increase, and you retweeted on 7/21 of 2017 that you were excited that you were going to get your raise, as the Speaker had approved it. This is 74% of the state workers, including the Veterans Home, people who work in our corrections institutions, who work with mental health, who work at St. Peter. I think it is a travesty that we are talking about a 2% and a 2.5% increase versus a 45% increase that the legislature took. So, Madam Chair, I believe that this is absolutely a valid contract that should have been approved by this body, and I think it's shameful what's being done today.
Okay. Any other closing comments? Senator Eaton.
Thank you, Madam Chair. As I worked for the state of Minnesota for over 30 years, and 20 of those were with AFSCME as an HST in St. Peter and in Anoka. And I want you to know that they are grossly underpaid. They are constantly injured. They work short. They are forced to work overtime, and very much underappreciated. They care for our families and friends who have a mental illness or who are developmentally disabled. Or they also work with It's a different group. But the fact that the people who provide these services, and that's not even talking about in the veterans' homes and the forensic people and the IT, and you think $45 an hour for a nurse is outrageous, you should see what the contracts they get for covering IT and because they can't find people who would want to work in the public sector in computers because they get paid so much more in the private sector. And they're getting, more like $100 an hour. So if you give the current workers a raise, we might be able to bring those people in rather than having to pay out these contracted workers. So I just want to say that not passing this contract is pretty much immoral. Thank you.
Okay, any other member question, or any other member comments before we go to the vote?
Roll call, Madam Chair.
Roll call being requested, or roll call will be granted. Any other final comments? Okay. You wanna-
Chair O'Neill,
Yes.
Representative Drazkowski,
Yes.
Representative Hillstrom,
No.
Representative Howe,
Aye.
Representative Lilly,
No?
Senator Benson,
Yes.
Senator Eaton,
No.
Senator Cran,
Yes.
Senator Newman,
Yes.
Senator Simonson,
No.
6 yes, 4 no.
Thank you. The motion prevails. Thank you, members from both bodies. Thank you for your time and attention today, and we are adjourned.